Sobering statistics tonight. New data from Harris County Health shows cases of HIV and other sexually transmitted infections are on the rise in our area and rising faster than anywhere else in Texas.
We're not in a fair fight. We're already outmatched and outgunned at all points.
I believe that it is quite highly possible that the AIDS virus is a result of genetic warfare testing.
It came from a private sector laboratory for money, because when they find the pill that you can take to let you do it again, somebody's going to make some money.
First, public health reports have shown that some U.S. cities, including Houston and Atlanta, have higher than average rates of sexually transmitted infections and HIV compared to national figures. Health officials have long noted that these disparities disproportionately affect Black and Latino communities, alongside other contributing factors such as access to healthcare, education, testing, and economic inequality. Experts emphasize that these outcomes are not caused by any coordinated plan or intent, but by long-standing structural issues in public health systems and social conditions that impact prevention and treatment. Discussions online sometimes reinterpret these statistics through conspiracy theories or celebrity commentary, but medical professionals consistently stress the importance of prevention, awareness, and access to care rather than speculation.
If you went on spring break in Houston, Texas, you might want to get tested. 28,000 people currently have HIV in Houston, Texas. 40,000 people currently tested positive for STDs in total.
Public health officials have long warned that STI rates can spike in large cities like Houston, especially during periods of heavy travel and social activity, such as spring break. While testing data sometimes shows increases after major events, there is no credible evidence supporting claims like tens of thousands of people returning with an STD in a single week. Health experts also emphasize that reported cases only reflect people who actually get tested, meaning real numbers are often underreported or misinterpreted. Instead of focusing on sensational figures, medical professionals encourage regular testing, safe practices, and better access to healthcare, especially in high-population travel hubs where transmission risk can increase.
42,000 people. Do you know how many that is? And there's other people who haven't even gotten tested who I got back from spring break. They're just like, oh, well, I don't have that on my lip, or oh, I don't have no symptom of burning or itching or any bumps in my mouth or any bumps down there or anywhere like that. Like, do you not realize that there's people out there that could have HIV and don't care to give it to somebody because they just want to do what they want to do and they want to live their life, because to them it's like, oh, it's not that big of a deal. I can live with this, someone else can. Baby, that's 42,000 people.
Recent public health data has highlighted ongoing concerns about sexually transmitted infections and HIV rates in parts of the United States, particularly in large urban centers like Houston, Texas. While social media often exaggerates or distorts individual stories, the broader statistics show a real and persistent public health challenge. According to federal health data, the national HIV incidence rate in the U.S. is approximately 11.4 cases per 100,000 people. In Texas, that number rises to around 15.7 per 100,000, already above the national average. In Houston specifically, estimates place the rate between 21.6 and 25.6 per 100,000, more than double the national figure. Local health studies have also identified certain neighborhoods, including parts of Montrose and the Second Ward, as areas with higher concentrations of new HIV cases. However, experts stress that sexually transmitted infections affect all demographics across Harris County, not just isolated communities. Public health officials emphasize that these disparities are influenced by a range of factors, including access to healthcare, testing availability, education, and socioeconomic conditions, not individual behavior alone or viral internet narratives. The focus, according to medical professionals, remains on prevention, early testing, and improving healthcare outreach across all communities.
Particular Black women. So Black women who are heterosexual are frequently getting STIs at a higher rate than other groups.
Data on HIV prevalence shows clear regional differences across the United States. Nationally, the rate of people living with HIV is estimated at around 308 per 100,000. In Texas, That figure rises slightly to about 327 per 100,000. In Houston specifically, estimates are significantly higher, ranging from roughly 464 to 566 per 100,000 residents. These numbers indicate that Houston has one of the higher concentrations of HIV cases in the country. Public health researchers also note that Black Americans are disproportionately affected by HIV nationwide, including in Houston and across other major cities. The Centers for Disease Control and Prevention, CDC, and other health agencies explain these disparities through a combination of factors, including unequal access to healthcare, differences in testing rates, socioeconomic conditions, stigma, and gaps in prevention education. These are long-standing structural issues rather than random events or intentional design. Public health experts consistently emphasize prevention, early testing, and access to treatment as the most effective ways to reduce transmission rates and improve outcomes across all communities.
They know where to look. You probably wonder, why do white people pay so much attention to Black people if they don't like them? You would think if you didn't like something, why would you be paying attention to it? I don't pay attention to things I don't like.
Katt Williams has previously made broader commentary about issues like the fentanyl crisis, suggesting that Black communities are disproportionately affected by overdose deaths despite not being the primary producers or distributors of the drug supply. It's worth noting, however, that public health and law enforcement data generally describe the opioid epidemic as a complex, nationwide issue driven by multiple factors, including illegal trafficking networks, prescription history, socioeconomic conditions, and unequal access to treatment and harm reduction services. Katt's statements reflect a perspective often found in social commentary, but they are not official public health conclusions or causal explanations supported as a single narrative by medical experts.
I'm gonna tell you a statistic that's gonna blow your mind. There are 0 making fentanyl. Look at white people. What?
Now,
When Katt Williams uses phrases like by design, many viewers interpret it as a critique of systems rather than a literal claim of coordination. The broader point he raises is about structure, how environments, incentives, and limited opportunities can shape outcomes for entire communities. In the entertainment industry, especially hip-hop, there has long been debate about who controls major labels, what content gets promoted, and how market forces influence artistic direction. Most major record labels are owned by large corporations led by executive teams, and the business decisions they make are driven by profitability and audience demand. Critics argue that this system can sometimes reward certain themes more heavily than others, which may influence what emerging artists choose to create. Others point out that artists still have creative freedom and that audiences ultimately decide what becomes popular through consumption and streaming behavior. When it comes to public health issues like HIV and STI rates, medical experts emphasize that the causes are unrelated to entertainment or media messaging. Instead, they point to factors such as access to healthcare, education, prevention resources, stigma, and socioeconomic inequality. Understanding these issues requires looking at systems and data, rather than attributing outcomes to intentional design or hidden agendas.
Even like in the rap world, like all of the rappers that you know that never been to jail and never gotten any trouble with the law, but they talk as if their life is opposite of that. Like those are federal informants. Like,
You think they're really out there?
Yeah.
Yeah.
That's part of the job, is to acquire those. It's like saying, if you're playing chess, do you have any pawns? You have to, don't you? You can't start.
There is ongoing debate about what gets promoted in mainstream rap and how industry incentives shape what becomes commercially successful. Critics argue that certain themes, such as violence, sex, drugs, and street life, often dominate mainstream charts, while other types of storytelling receive less visibility. However, industry analysts also point out that hip-hop is extremely diverse, and many artists across different styles and messages have achieved mainstream success. In the modern music business, streaming algorithms, audience demand, and label investment all play a role in what gains traction. This creates a system where popular trends are amplified, but artists still retain creative agency over what they produce. Katt Williams and other commentators have used this landscape to raise broader questions about influence, messaging, and responsibility in entertainment. However, public health experts emphasize that medical outcomes like HIV and STI rates are driven by factors such as healthcare access, education, prevention resources, and socioeconomic inequality, not media content or entertainment trends. Historical mistrust in institutions, including events like the Tuskegee syphilis study, has also shaped how some communities interpret present-day disparities. But researchers stress the importance of separating historical wrongdoing from current public health data and avoiding conclusions that imply coordinated intent without evidence.
Didn't drop hints. He said it on camera, sitting across from Barbara Walters all the way back in 1998.
You know what I'm getting at? I read that you felt that the government was deliberately spraying cold germs in subways, was deliberately trying to make people ill with the AIDS virus. This is pretty serious stuff. Do you really feel that?
I believe that it is quite highly possible that the AIDS virus is a result of genetic warfare testing.
By American agents?
Absolutely.
Well, why
am I a conspiracy theorist? I'm a conspiracy theorist, aren't I?
But
what often stands out in resurfaced interviews is the way public figures express concern about scrutiny and consequences for speaking openly. Clips like Will Smith's remark, "They're going to chase me after this," are frequently shared online, though the full context and interpretation vary depending on the source. From there, conversations online often shift toward historical events that have shaped public trust in institutions, particularly in healthcare. One of the most well-documented examples is the Tuskegee syphilis study. Conducted by the U.S. Public Health Service between 1932 and 1972, the study involved hundreds of black men in Alabama who were told they were receiving treatment for bad blood. In reality, many were not given proper treatment for syphilis, even after effective medical care became available. The study was eventually exposed, leading to widespread public outrage and major reforms in medical ethics and research oversight. This history is often referenced in discussions about health disparities today because it contributed to long-term mistrust in healthcare systems among affected communities. However, modern public health organizations stress that current HIV and STI patterns are not the result of coordinated intent or targeted design. Instead, they are explained through a combination of factors such as unequal access to healthcare, education gaps, socioeconomic conditions, stigma, and differences in testing and treatment availability. These are complex systemic issues that require evidence-based solutions, not assumptions of hidden agendas.
Oh, that's a serious one. Okay, so I got it now, because people are going to chase me after this. People are going to chase.
Tending to inoculate people and that type of thing.
The idea being to kill black people?
Yeah, to eradicate black people. You must understand the concept was that AIDS was a killer. It was incurable at that point in time, so it was led to believe that if you infected people, it was the quick, non-militaristic approach to eliminate black people.
And that is something you know for a fact, that AIDS was actively being spread to other countries?
Yes, to African countries. We were at war. Black people in South Africa were the enemy.
But so it was about white supremacy?
Definitely. Definitely trying to retain the white supremacy.
When you look at public health disparities in cities like Houston, it's natural that questions and strong opinions emerge, especially given historical events that have damaged trust in institutions. One of the most cited examples is the Tuskegee syphilis study, a real and widely condemned case in which black men were misled and denied proper treatment for decades by the U.S. Public Health Service. This event led to lasting reforms in medical ethics and continues to shape conversations about trust in healthcare today. Because of this history, discussions about present-day health inequalities often carry deeper emotional weight and skepticism. Some commentators, including public figures like Katt Williams, use that context to raise broader concerns about systems, access, and inequality. However, public health experts explain current HIV and STI disparities through well-documented factors: unequal access to healthcare, education gaps, socioeconomic inequality, stigma, and differences in testing and treatment availability. These issues are structural and complex, not the result of coordinated intent. As for cultural influence, music and media can shape perceptions, but they are not considered causal drivers of disease rates by medical or scientific authorities. Ultimately, experts encourage focusing on prevention, education, and improving healthcare access rather than attributing outcomes to hidden agendas.